not in my words, not in that way, not in my name, not in my faith, not in my words, not in that way.
Welcome viewers to another edition of A Muslim's Perspective. First we praise God Almighty, we praise Allah, and we praise Him. We ask for His guidance and forgiveness, and we seek protection in Allah from the malice of our own souls and the evil of our actions. Whom Allah guides, no one can lead him astray, and whom He makes astray, no one can lead him back to the right path. I bear witness that there is no other deity but Allah, by Himself, no associates to Him. I bear witness that Muhammad is His servant and messenger. Our guest today is from the Canadian Muslim COVID-19 Task Force. Her name is Samiya Abdi. She's a senior public health and health equity specialist who is the community outreach lead with the Canadian Muslim COVID-19 Task Force. Welcome, Sister Samiya.
Jazakallah khair, Brother Alim. Wonderful being here. Barakallah feek. Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. I would like to, first of all, start by acknowledging and being grateful to Allah subhanahu wa ta'ala for giving us these opportunities and for giving us health and protecting us from this pandemic that we're in. And thanking Brother Alim and his team for hosting us and having a representative from the Canadian Muslim Task Force be here to speak to all of you. And that being said, given that today is September 30th, Brother Alim and I would like to start with a land acknowledgement, acknowledging that particularly today we are in the Peel region in Mississauga, city of Mississauga, and that this land is a land of indigenous people, many indigenous people, including the Anishinaabe, Huron-Wendat, Haudenosaunee, Chippewa, and Ojibwe peoples, and there has been for the past thousands of years many First Nations, Inuit, and Métis people who've walked this land and lived it. And also with that, we also recognize not only indigenous people, but their language, their culture, their ways of governance, their systems of knowledge, and recognize that there has been a deliberate and intentional genocide and removal of people and destruction of culture and destruction of language, and that indigenous people continue to call this land home, and also recognizing as Muslims the responsibility that we have not only to listen, to learn from, but to support and act upon truth and reconciliation recommendations, to read and understand the reports around missing and murdered indigenous women, and to donate to, support, volunteer with, advocate with indigenous peoples of this land as we call Canada home. With that also comes a lot of responsibility, including understanding that there are people who are whose land we are on and are under active colonization.
Thank you very much for that, Sister Samiya. In terms of our subject matter today, we're dealing with pandemic, the COVID-19 pandemic, viewers. Historically, pandemics have ravaged humanity. In some instances, certain diseases remain virulent for more than 200 years. For instance, the plague of Justinian, which was started in 542 AD. Pandemics were a major concern in early Muslim history. Some interpreters of the Quran are of the view that, quote, casting against them stones of baked clay, unquote, mentioned in Surah Al-Fil, chapter 105 of the Quran, verse 4, was describing a plague-like disease that wiped out Abraha's army of elephants. There are numerous hadith attributed to Prophet Muhammad ﷺ on this subject. From the text and lived experience, the early Muslim community set the framework for communal behavior when confronted with pandemics. Rule number 1, pandemic was considered a mercy from God and martyrdom for the faithful Muslim and a punishment for the infidel. 2, a Muslim should neither enter nor flee a pandemic-stricken land, that is quarantine. On January 9th, 2020, the World Health Organization announced mysterious coronavirus-related pneumonia in Wuhan, China. Since then, close to 250 million people have been infected and over 5 million died worldwide. In Canada, just over 1.6 million infections were reported, with close to 28,000 deaths. The authorities here in Canada and worldwide have instituted public health measures and made available vaccines for free to prevent the spread of COVID-19 and to protect the health of people. Sister Samiya, what is public health and why is it necessary?
Public health is similar to primary health care. It's the protection and prevention of disease and promotion of wellness to larger communities and at a population level. So the same way we have physicians, family doctors, and other forms of doctors that deal with individual health and wellness, public health deals with the wellness and health of populations in general. So public health includes things like injury prevention, health promotion and wellness, infection control, and particularly during the pandemic, because this is a population level health crisis, it is the public health measures that have to be at the forefront while we still rely on our physicians and nurses and other healthcare providers that will support health and wellness at an individual level.
When we look at the maqasid of Sharia, the second principle in it is the preservation of life. So in Islamic law, preservation of life is important. Why is it the responsibilities of governments to have public health policies in place?
Well, at least in I can speak only for the country we're in and the government that we are part of, or the government that we elected recently, that health and wellness is, at least in Canadian context, we have a universal health care, and that means the responsibility of the government is to ensure the health and wellness of the population overall, regardless of gender, sex, religion, age, geography. It is the responsibility of our governments, and the way that our healthcare is funded is that it's not an individual responsibility, but a public responsibility, something that we all need to get to come together and support so that the health and wellness of our population is protected.
Yes, and from where I sit, my perspective and understanding is that the primary responsibility of any government should be the health and safety of the population which it governs.
Absolutely.
Having said that, we've seen the Canadian government manage, from my assessment, in a very dynamic situation. I think they've handled the file very responsibly. Why was it necessary for Muslims to form the Canadian Muslim COVID Task Force?
So the Canadian Muslim Task Force has been formed since March 12, 2020. So that was actually a week before we had our general lockdown, the first general lockdown that we had in this province. And it was actually a very, a lot of foresight from our community leaders to have come together. And the Canadian Muslim Task Force has 3 pillars, which is, we say these are the foundations that we stand on, which are Muslim healthcare providers and healthcare professionals, imams and religious leaders, and finally community organizers and community organizations and leaders who are all part of the Canadian Muslim landscape. Early on, so as someone who works particularly in health equity, we understand even though we do have a universal healthcare system, all things equal are not equitable. So just because we are treating people equally, it does not mean we are meeting their needs and their particular needs. And so when it comes to particularly racialized communities who live in under-resourced neighborhoods, communities who might have linguistic challenges or cultural differences that does not allow them to benefit from the healthcare system, similar to maybe the mainstream society benefits from. When we just started with the land acknowledgement, understanding that there are systemic racisms that this country was built on, including our healthcare systems, have nuances and policies that exclude certain groups of people. As a Black Muslim, I also recognize that there is a long history of slavery and disenfranchisement of Black communities, and also by extension a lot of racialized communities. So that being said, for those of us who've been part of health equity and the healthcare system, we recognize that already racialized communities, which a lot of them happen to be Muslim, are disenfranchised from the healthcare system, might not have easily accessing. If you recall, early on there was also a lot of confusion around messaging, where to get the correct information. And even as recently as when the vaccine rollout started, there was a lot of inequities because a lot of the information was only accessible through Twitter, or if you had online booking. And so if you are an older person who does not have access to the internet, or if you are a young person who does not have a computer of your own or a cell phone with a data plan, it made it very difficult for people to get the right information at the right time. Furthermore, as Muslims, we have communal practices and religious practices that had us necessitate us to be able to provide guidance and information that were specific to us. So one example, one of the first things that the Canadian Muslim Task Force called for was the suspension of congregation prayers, particularly Jum'ah. And knowing that we pray, feet to feet, shoulder to shoulder, that proximity, knowing that Jum'ah is mandatory on Muslim males and highly recommended for Muslim females. And in this country, we have such a high number of people who attend Jum'ah. Naturally, these settings would constitute a higher rate of transmission in our communities. So early on, there needed to be. That is the kind of information that non-Muslim public health professionals and policymakers will not have at their fingertips unless they have a Muslim physician or a Muslim healthcare provider at the table and a Muslim policymaker at the table that can bring forward those perspectives.
Yeah, and in terms of practices like that, Juma and so on, there's a question of if you're not a partner at the table deciding these policies, the community might think that it's a form of oppression,
yes,
rather than against public policy and aiding in the help of every citizen, which is mandatory on each of us. We have to look after our neighbors, so to speak.
Absolutely.
But in terms of the Canadian Muslim COVID-19 Task Force, who is its target audience? Because generally, when you speak of these things, the general Muslim population is the target audience. But up to 2 nights ago, I got a WhatsApp message. I saw that there was a single mother who was in fear of taking the vaccine. So is the messaging getting out there that what the CMCTF is doing, is that messaging reaching them, or through what mechanism is there for it to reach the general Muslim population?
So our audience is actually multi-pronged. So the general Muslim population, including that single mother that you're speaking of, is an audience members that we are targeting. We target our audience through Facebook messaging and Twitter and social media and WhatsApp messaging, because we know how often our communities use these platforms. We target our communities through words of mouth and holding community town halls and producing educational materials that are actually our materials are up to 14 languages right now, translated into 14 languages. We've held culturally specific, because we also understand that the Muslim community is not a monolith. We come from communities from all around the world. We speak multiple languages. We have different practices, although the basics are the same, but we have nuances that are very important to understand and ensure that there is representation when we're talking, when we're creating these messages, but also how we're sharing them out. So even though the general Muslim public is part of our audience, but also our imams and masjid leaders especially our masjids are very, very key partners as well as audience members. So we've held a number of, consultations with masjids when they were dealing early on around the measures and how to implement it, and even right now we know that we've been supporting a lot of masjids, alhamdulillah, across the nation that have held actually vaccine clinics in the masjids, because we know also our communities, as a faith group, alhamdulillah, our majority of our communities are connected to the masjid. And for the members of our communities who are not connected to the masjid, that is where we're trying to reach out through shows like yours and other media outlets and social media as well as WhatsApp groups. And finally, our audience is also the public health professionals and the physicians and healthcare providers on the other end, both the Muslim ones, so they understand what their communities are going through and what perspectives that they need to bringing forth to the table, as well as non-Muslim ones. So we've been working with health authorities across the nation to understand that as a subgroup that they serve, that they need to understand the needs of the Muslim communities and to tailor their messaging in ways that the Muslim communities can not only understand it, but trust it and adopt these measures.
Alhamdulillah. So just to clarify, when the Canadian Muslim COVID-19 Task Force sits at its policy or decision-making desk, at this table, you have medical experts who have years of expertise in dealing with diseases, plus you have imams and religious scholars who are versed in our Sharia, in our path to water.
Yeah.
And we also have the principal organizations. So it's not like it's only the science-based persons are dictating to the community. It's a collaborative effort. Am I understanding this correctly?
That's 100%. And as someone who is part of the community, but also is a health professional, we have to walk that fine line that we're not mouthpieces to policymakers and government, but that we are taking into consideration evidence-based science, but also understanding the needs of our community. So I'll give you an example. For example, when the vaccine clinics were opening up, particularly during Ramadan, we had to understand what were the Sharia understandings. Does vaccination break your fast, for example, was one of the questions that we had, discussed with our imams and religious leaders, and the answer was no. But understanding our community and that the majority of the people would not want to get vaccinated while they were fasting meant that we were able to advocate and work with clinics and public health professionals to extend the vaccine clinics beyond Maghrib, so after dark. So have these fun after dark clinics open up, particularly in neighborhoods and masjids and in areas where we know that there's a high percentage of Muslims.
And has that advocacy been successful?
Absolutely. So one of the things that people were really worried about in a lot of the racialized communities, including the Muslim communities, that there would be fear or concern or hesitancy or refusal to take the vaccinations. However, a lot of what we've seen is actually when access was provided, when vaccines came to safe spaces where communities gathered, such as masjids, such as community centers, such as mall parking lots, where people felt comfortable, as opposed to hospitals, which people do not go to hospitals unless you're in an emergency or something really seriously went wrong. Hospitals are not cozy places that people feel comfortable in. But when as public health, as a part of the public health measures, when vaccines were provided in comfort places, then people lined up. We have images and pictures of communities lining up for 3 hours, waiting in the cold and the rain to get vaccinated. And that kind of debunked a lot of the myths that initially folks had around the reception of any kind of health measures by racialized communities, including the Muslim community.
What sort of a response? You're not right in the face of the community, so to speak. More of your work is done at policy making level and coordinating with the various organizations and imams and so on and so forth. Have you gotten any feedback from the community, general community, about its response to the work of the Canadian Muslim COVID-19 task force?
Yeah, I believe so, because for example, our community town halls are open to the public. So when we have over 11,000 views in some of these, webinars, for example, and in attendance and live Facebook viewing or Twitter viewing, when we have the responses and the comments that are people are grateful, or even when we have an opportunity for people to submit questions in advance, and we have 50 to 60 questions that are coming in a particular webinar from our community members, that means that there is an interest, particularly when all of this information was new. And now it's more like the basics are, people understand the basics. But for the first, almost 6 months, this was new to everybody. So it was a matter of understanding that there is a collaborative, community collaborative available to answer both community level questions and individual questions. And because we work with, as you said, imams, and we work with community leaders, they are our gateway to the community members that they're connected with. Most of our consultations are with imams who, people are calling in the middle of the night because they're worried about, something, or they are not sure about the validity of something. So the imams are actually our deepest connection to the communities.
Alhamdulillah. And they are overworked and underpaid.
May Allah subhanahu wa ta'ala bless them in this life and the hereafter.
Ameen ya Rabbi. There have been so much talk, especially like in the last elections campaign, about protesting vaccine anti-vaxxers, and people are deeply suspicious about control. Have you found that within the community, Muslim community, that there's representation of this degree of, or this attitude?
I mean, there are always, pockets of concern that people might have. So what I would like to maybe just as we begin this part of the conversation is to kind of differentiate between people who have legitimate reasons to worry and to concerns that are needed to be answered. And particularly when there has been historical reasons for people to doubt some government actions. So there has been in the past, particularly on racialized people, whether they are, particularly indigenous and black people in this part of the world, there is a mistrust in the system because there has been, yes, exactly, there has been experimentation, there has been sterilization of indigenous women. So there has been, the healthcare system in this land has not always been moral or ethical when it comes to, indigenous, black and racialized people. And furthermore, there has been and continues to be experiences of discrimination and othering and dismissal of people's symptoms even till today. So we need to separate between legitimate concerns and mistrust in the system that is rooted in both current day experience and historical reasons. And, just blind hate of the system and, for no good reason. So a lot of the experiences that we had within the Muslim community and generally in racialized communities are those concerns. And once these concerns are addressed, once there is an understanding of, how did this vaccine come about? How did these measures come about? Why are they being done? When there is simple, like that mother that is worried, for example, for herself or her children, often what we find is when there is a conversation that is being had, and when that conversation comes from a person who understands the root causes, then it goes a lot smoother, and people are often just looking for more information and clarification. But obviously there are fringe populations that are what are coined anti-vaxxers. Those folks are not very, they're not large portion of our communities, but they do exist within our communities, and particularly folks who have been, listening to right-wing, white supremacist ideologies, and often these are the groups that are linked to this, and comparing things like, I think last week I saw comparing unvaccinated and vaccinated with the racial segregations of the 50s and the 40s, and saying that it's like colored and uncolored, like equating slavery to, for example, and loss of rights to being vaccinated.
We will continue more on that conversation after this short break.
Not in my faith, not in my words, not in that way.
Welcome back, viewers, and we are having a very intense conversation with our sister Samiya Abdi, who is representing the Canadian Muslim COVID-19 Task Force. She's a senior public health expert as well as community outreach for the Canadian Muslim COVID-19 Task Force. Sister Samiya, are the vaccines safe?
So they are as safe as, there's risks to everything. If you take Tylenol today, or if you take cough syrup, or if you take any medication, there's always a risk associated with it. For example, if you go for as simple as a tooth extraction, you are at risk of getting infection from that tooth extraction. So we do not live a risk-free life, and we are not walking around with bubble wraps. So that being said, the vaccines have very, very minimal risk. Only very few people have side effects such as fatigue, or soreness of muscles, or headaches, or mild fevers. So compared to these side effects, in comparison to the side effects of COVID, which is really around loss of life and serious injury, including collapse of lungs, not being able to breathe, having long COVID symptoms such as continuous fatigue, as well as fogginess, and a lot of other serious side effects that people are experiencing as part of long COVID, or immediate chronic symptoms because of COVID. So when we compare those risks of these two things in place, we understand the risks are very, very minimal with the vaccine, as opposed to contracting potentially COVID.
Yeah, and I just wanted to pay tribute to the couple that discovered this first vaccine, the mRNA technique that was used. Two Muslims, Turkish origin, in Germany, Ugur Sahin and Özlem Turisi, if I get the pronunciation right. If it was two Muslims doing damage to the world, you'd hear about Muslims in a negative light.
Yeah.
But you hardly ever hear that these two scientists were the first, made the first breakthrough in terms of getting a vaccine for this disease. And we know that Allah has promised us in the Quran that there is no disease to which there isn't a cure.
Absolutely.
So we should just take a moment to congratulate and to pay gratitude and homage to this couple,
Yes.
in of Turkish and Muslim background. And they were recognized prior to that and got an award, I believe, of $300,000 by some Muslim countries about 2 or 3 years before this actual discovery.
Wow.
So in terms of their talent, it has been recognized.
Amazing.
And accepted. How effective are these vaccines?
So these vaccines are very effective in terms of highly effective in both prevention of contracting the illness, as well as reduction of symptoms if the person contracts it. So what we have seen is currently with the Delta variant, which is a little bit of it's a little bit different than the first variants that we were experiencing in Canada, is that first of all, it's very unlikely that the person who's vaccinated gets the infection, and if they do contract COVID, what we're seeing is a tremendous amount of reduction in the severity of the symptoms, as well as the seriousness of outcomes, so including mortality and hospitalization. So what is the experiences of the few people who are getting COVID despite being fully vaccinated is that they are experiencing cold-like symptoms or regular flu-like symptoms. So, you know, if you remember a couple of years ago before COVID, when you got a cold or when you got a flu, you had muscle ache, you had fever for 2-3 days, you had headaches, and you had runny nose, you might sneeze. You know, those symptoms that we are really accustomed to and our bodies are able to fight and recover from very, very shortly.
Yeah, I read a tweet last night in which a hospital in the United States said that they had 302 patients in their ICU for COVID infections, and 100% of them were unvaccinated. So now it seems that we have moved from a pandemic of the general population to a pandemic within the non-vaccinated population.
Absolutely, and we know that in Canada that is still 20% of our population is unvaccinated or not fully vaccinated, and with that, and especially with, I was just on my way here, I was listening to the CBC, and there was a report around, you know, the risk that we have is still that the potential collapse of our healthcare system, because our physicians are exhausted and our nurses are, you know, overworked, and with 20% of the population still at risk means that our ICUs are still going to be full, and we are still going to be really caring for folks who at times maybe did not have access to the vaccine or did not know where to get the vaccine, but also the very few fringe folks who just simply refuse to get vaccinated and still will place burden on our healthcare system.
Yeah, some people seem to be framing this question in terms of rights and freedoms. Now, I like to spell freedom two ways, F-R-E-E-D-O-M in a normal way, and F-R-E-E-D-O-M-B, just as a way of an aside. But our faith teaches us to take care of our neighbors.
Absolutely.
To the degree that the companions asked the Prophet ﷺ, or felt that what he was saying to them in terms of the responsibility to neighbors was such that they could inherit from you. As an unselfish act, what would you say to a Muslim in terms of, okay, it's your freedom not to do this, but what about your neighbor?
Yeah, so unless you really live in isolation, unless you live in a very, very remote area, you never come in contact with people, you grow your own food and fuel, and you're not really in touch with any other human being, then you know you can literally live in that bubble and this is about you. But the moment that you are interacting with people, whether it's at a grocery store or a gas station or at a bank or at a hospital, you are not only exposing yourself to the risks, but also every single person you come in contact with. And we know that there are people who are immunocompromised. We know children under the age of 12 cannot get vaccinated up to this time. So it's not about only ourselves, but it's about protecting vulnerable proportions of our community, whether they are people who are immunocompromised or people who, you know, children who cannot get vaccinated at this time. So it's not really about us, it's about everybody else around us as well. And what I just talked about in terms of it's about also protecting our healthcare system. So people who are having heart attacks can still go to the ICU. That people who are, dealing with cancer and other serious conditions can still go to the ICU and get the proper care that they deserve, and not for our healthcare system to be bogged down by COVID cases.
When it is preventable at this stage.
Exactly.
The vaccine itself, in terms of, you were mentioning, if you can still get after you're vaccinated, but hospitalization is minimal, if any, is required for the vaccinated person. Are there long-term side effects to the vaccine?
Well, what the experience of vaccines up to this date has been that most vaccines that have side effects, the side effects are experienced within the first 6 weeks of vaccine. So this is historical knowledge based on other vaccines that we've had over the past few hundred years. That being said, there has been continuous studies over the past almost 2 years now, year and a half, that people have been vaccinated, including the study group. There hasn't been any documentation of long-term side effects for the vaccine. However, we are already seeing the long COVID side effects. So people who've contracted COVID in the first wave, including people who are that got contracted vaccine prior to the vaccine availability, are still dealing with a lot of the side effects, even though it has been more than a year and a half later. So what we know is, in terms of long term, there's the known and the known unknown. What we know for sure is that COVID also has a lot of long-term side effects that people have been experiencing. What we do not know or have no evidence of is that the vaccine has any side effects.
One of the permanent side effects of getting COVID is death.
Absolutely,
And
the most permanent one.
You have a lot of families who have to now not only mourn the passing of a loved one, but replace the income that was being provided by that member of the family, and they are left in poverty. So, taking the vaccine, as you rightly pointed out, it's not only about you. It's about your immediate loved ones and your neighbors.
Absolutely.
So, I think a lot of the distrust was generated because there was so much unknown and uncertainties.
Yes.
I remember at the beginning, mask wasn't necessary, then mask was necessary, and so on and so forth. The situation was very, very dynamic. So you had the messaging, changed at different points in time. And that seemed to have generated some distrust. How can we overcome that distrust that's there in governments, in the media, in the medical experts, in public policy experts, when people have basically tuned out? They aren't listening anymore.
Yeah, I think it's to continue having opportunities for these conversations. And as we talked about earlier, creating opportunities for people to continue asking the questions. So, and air out their concerns and not to dismiss them. So if there is someone who has real concerns around whether it's safety or the measures or the protocols that are related to prevention or to the vaccine, having opportunities to have the conversation is a starting point. And we cannot afford to give up on these people who are, the 20% that are still not vaccinated in our country, not only for our sake, but also for their sake, because at the end of the day, we are, as you said, one of the maqasid al-sharia is to save life. So we care about you, whether you're vaccinated or unvaccinated, and we're here to support you, inshallah, and to help protect you and your loved ones, as you talked about.
Yeah, full disclosure. I was infected with COVID in November of 2020. I was not born in a hospital. I spent one night in a hospital around age 6 for a broken collarbone. And I had to spend 2 nights in the hospital in November because of COVID-19, 56 years later. And hospital and myself, it's a difficult combination. And I've also been double vaccinated with the Pfizer vaccine. So as a matter of advocacy, I prefer the side effects, limited as they are for a few days with the vaccines, than what I went through with COVID-19 in November 2020. The coughing just wouldn't stop, double pneumonia.
Yes.
And when I asked the doctor in the hospital, can you please give me something to stop the cough? No, sir, we don't give anything to stop that cough. Right? And, you know, thankfully, I'm here speaking to you today and speaking from primary first-hand experience. Viewers, please get vaccinated. It helps. You know, like, for example, in terms of vaccines, we have the Ontario government now recommending Pfizer vaccine for use of those who are aged between 18 and 24 rather than the Moderna because of the observed increase, though very rare, of heart conditions. These sorts of changing observed scientific facts as they come about and government changes, don't you think it generates more distrust? But what can a public policy official do except to follow the data? Exactly.
So we know that this pandemic has caught us by surprise and also meant that there was a lot of unknowns, and we literally are building the plane while we're flying it. So as these measures come up, as the protocols come up, we are learning more and more about it every day. It is the responsibility of those of us who are in the healthcare system or at policy-making levels to continuously communicate with the public and to explain the facts and the new evidence in ways that people can understand and anyone can understand without using jargon or difficult language or things that cause further confusion. So with these new, I think if anything, this should generate more trust in the system, because the fact that every day more and more is being learned about this, both the vaccines and the COVID side effects itself, means that there is an opportunity for continuous improvement. And that means that we're putting everything we have. This is a worldwide effort. There has never been this level of collaboration between governments, between scientists, you know, the funding that has gone into, the brain power that has gone into. So this is a multinational, worldwide effort to get rid of this pandemic, to bring back economic stability, to bring back to life better than we remember it as, to ensure that people's lives are saved, and not only, but to also ensure that the people are living good quality of life, not only just living.
Indeed, and in terms of economics, it was very heartbreaking to see even in the most powerful nation on earth, in the United States, you had people with expensive cars lined up to collect food at food banks because they just did not have the income, because they lost their jobs.
Yes.
So economic stability is necessary for us to even have a chance of living a stable and healthy life. Mm-hmm. And this COVID-19 is impacting in ways we are yet to feel. Right now, for example, you couldn't even get a new car if you wanted. You might have to wait a year, 2 years because of logistical problems. Mm-hmm. COVID impacted production. Mm-hmm. The job that I do primarily, we import and export. We can't even get containers onto ships, even if you pay 10, 15 times the price of freight prior to COVID. All that's going to impact onto inflation rates. So it is beyond just my choice of taking a vaccine or not taking a vaccine. Mm-hmm. Until we are able to seal COVID-19 into a bottle and throw it into the sea or wherever we need to dispose of it, we will never get back to normal.
Yeah.
So it is our individual responsibilities mm-hmm. to take that step. We got to trust those in authority. People are saying, I'm doing my research, mm-hmm. but they're in their echo chambers. I read it on the internet. I saw it on YouTube. What do you have to say? in terms of this type of research being done and being informed by these echo chambers?
Yeah, I mean, at the end of the day, when you have symptoms, you go to your family doctor, your physician. You could definitely Google it and go to md.com and try to diagnose yourself and try to treat yourself. But the most reasonable thing that most people do, if you have an infection in your leg, you don't sit around and wait and try to, like, put salt in, water, which is useful sometimes, but not in if you have or olive oil, right? Those are preliminary treatments, right? But there is a stage at some point where you recognize that your infection is not going down, you're having fevers, you have, I don't want to be graphic, but I'm sure most of the people who are watching us understand what an infection looks like. But you don't go sit around, especially when you have access to a free health care. You go to your family physician. You go to the emergency if you need to. You don't just figure out that I'm going to just cut off my leg since now it's infected, while you know that there is treatments in place and things to support you. So it's interesting that we are willing to trust our doctors. For the past hundreds of years, we've trusted our physicians and we've trusted our healthcare providers and our hospitals to give us the best advice possible, and based on scientific evidence, based on research. But all of a sudden, all of that is thrown out of
something called the internet, Dr. Google.
Right? So the same way you cannot research your own, you cannot perform your own heart surgery by watching a YouTube video, and you cannot become a heart surgeon by a few hours of YouTube videos and doing a little bit of internet research. It's the same thing. You cannot be an expert and fully understand the evidence without having an opportunity to interact with and listen to the people who are, Allah subhanahu wa ta'ala says that to ask the people of knowledge. And this is also in the same way that we have Islamic scholars, with people who've spent their whole life studying the religion. And as lay people, I cannot come up with a fatwa and give a fiqh opinion without studying and spending the time under learned scholars to understand what is the condition and what's the ruling. So the same way we ask for guidance as Muslims, particularly ask the people of knowledge.
And that's the wise things to do. And the opposite to that is when news reaches you, verify it. And some of us just aren't equipped with the scientific, basic education to verify anything. So we have to go to people who have made a lifetime of study of these matters to verify the information, lest we spread ignorance and threatens people's lives, if not really be the cause of taking people's lives.
SubhanAllah.
And it is essential, viewers, it is essential that we base our decisions on those advices that comes from people who know. I cannot overemphasize it. Sister Samiya, if someone wants to get more information on the Muslim point of view, the Muslim Task Force, where can they get information?
So they can Google us. We are online, we're on Twitter, we're on Facebook. As Brother Alim was mentioning, we do have a very large WhatsApp reach in our communities. So you can reach us on our website, but also all other forms of social media. Inshallah ta'ala, share with us your questions, your concerns. If there are topics that you are not on the website, but you deem that it's important for us to cover it, we're happy to cover it. And just to mention one more thing, that the Canadian COVID Muslim Task Force is a 100% volunteer-run organization with no sustainable funding from any government or other source, and it is literally your Muslim physicians, your Muslim health care providers, your Muslim community leaders, your imams and scholars who are literally working day and night to provide this information, to translate it into different languages, to come to you in your homes and provide the best available evidence, inshallah ta'ala, so we can all stay safe and keep our loved ones safe, our community safe, and ourselves safe, inshallah ta'ala.
Yes, and I just want to point out one thing. When I went to the website, many of the questions that you have as viewers, you would have had, have already been answered in a section, frequently asked questions. Please do visit their website. It will be on the screen, and you can, go out there and you can get, this is reliable information from a faith-based, using scientific data and knowledge to provide you the best up-to-date information for you to be guided. Please make a wise choice. Until we speak again, peace out. Assalamu alaikum.
Not in my name, not in